Hello everyone, my name's Ayesha Ashmore. I'm Research Fellow in Gynae Oncology at the Royal Derby Hospital, and today I'm going to give you a brief introduction to audit and quality improvement in healthcare. So to start, I'm going to talk a little bit about audit and quality improvement, but really, why do we actually do these things and why are they useful to you as a medical student to know about? So first of all, audit and quality improvement are tools that are really important in continuing improvement within healthcare. So what do I mean by that? So we know that safety is paramount within medicine, but actually how do we make sure that something is safe and what we're delivering is good quality in terms of safety or effectiveness or efficiency? And audit and quality improvement are two tools which can help you identify that and also make improvements when they're needed. So the reason that you need to know about this as a medical student is because you're going to need them when you qualify. It's part of foundation training and it's often a part of specialty training requirements as well. So getting the basics of what audit and quality improvement are at this stage is going to be very useful for you and also fruitful towards your future careers. And lastly, the other thing I really like about audit and quality improvement is that it's a way that you can affect change yourself. I find that a lot of times you work in different departments or even when you're in medical school and you find inefficiencies or annoyances in the way that things are done or things that just don't work. And this is a way that you can identify problems, evidence those problems and then implement a change which then you can be proud of and importantly put it on your portfolio so that it benefits you in the future. So audit, what is audit? So I've done a lot of Googling and this is probably the best definition I can find, but it's a systematic examination or review of healthcare organisations, processes, practices and outcomes. And the purpose of it is to identify new areas for improvement and ensure compliance with standards. And now that the compliance with standards part is really important because that's one of the things that differentiates an audit from a quality improvement project. So what we're really asking is what we're doing up to standard? And are we doing what we say we're doing? So standards are things such as guidelines, and these can be national guidelines or they can be local guidelines, they can be protocols, they can be whatever you would consider is a standard of practice within your healthcare setting. And what you do in an audit is you try and work out if what you're doing in your healthcare practice or setting is actually what a standard which has been developed is saying you should do. Quality improvement is slightly different. So the definition is ongoing efforts to improve processes, systems and patient outcomes. And the purpose is to emphasise patient safety and satisfaction. So it's slightly different because we're not comparing our practice to a standard, but actually what we're asking is what can we do to improve this for patients or how can we make this more efficient? And so it's slightly freer. You have a bit more agency in what you do with quality improvement and you can get a little bit creative. But actually, audit and quality improvement, they kind of go hand in hand because often you may do an audit and then find a problem and then you want to do a quality improvement project to implement a new change and then re-audit afterwards or something like that. And there's lots of different ways of kind of merging these two tools, but for the time being, as you're just starting out, let's try and keep them separate. So why do we do it? So we want to enhance patient safety and also improve the quality of care, but we also want to make sure that we're compliant with our regulations and standards, and we also want to optimise healthcare efficiency. So those are the reasons that we do them. There's different components to audit and quality improvement, and it all kind of comes down to the different reasons why we do the different types of project. So with an audit, we want to establish an audit criteria and standards, collect data, and then analyse that data and then make some recommendations for improvement based on whether, you know, we are compliant with standards or not compliant with standards. And so often if you are compliant with standards, you may not need to make a change, or you may just say, actually, we're doing really well, we carry on doing what we're doing, but we'll want to come and re-audit this in a few months' time to make sure that we're continuing to maintain our standard. Quality improvement is slightly different because we come up with a problem which may not have a standard, and so you've kind of got to work out what your objectives are when you're trying to develop your project, and do you have any goals which can be measured so that you can then compare what things are like before you implement a change and afterwards. And then after you've implemented change, you need to work out, how do we monitor this, how do we reassess this, can we audit it? So they're slightly different. So just to hammer this home again, audit focuses on compliance and identifying problems, whereas quality improvement focuses on continuous improvement and implementing solutions. And if you have a look at this diagram, you can see that particularly for quality improvement, if the standard is here, an audit looks at, are you reaching this standard? But quality improvement can improve that. So you can do a cycle of quality improvement, and actually over time you can identify ways to improve so that the standard actually gets better. And then, you know, if that's adopted by national guidance or local guidance, great, because then you will then audit to a higher standard. And then that kind of shows how audit and quality improvement interacts. So I'm going to talk a little bit about how you actually do these two different types of project. So don't worry, I'm going to start with a little bit of theory and then I'm going to give you an example. So just bear with me. So with an audit cycle, we identify a problem and then we define the standard, so a criteria for assessment. For example, the NICE guidance might suggest you have to do certain tests before you are referred to for a specialist review. A good example of that is in ovarian cancer. When you suspect ovarian cancer in the community, a GP normally does a CA125 test and an ultrasound scan before they refer the patient to a hospital for secondary care assessment. And what you could do is say, or you know, we want to make sure that all of our patients are having these two tests done because it improves our efficiency. So you can define your standard like that. Then you want to collect your data and analyse your data as well. So are all of these patients having these two tests done, or are only 50% of your patients having these two tests done, or whatever. And then you want to share your findings and make some recommendations as to what you could do to improve things if you aren't up to standard. Then after that, you want to action any improvements, and the most importantly is to re-audit, and that's so that you can assess the impact of your changes. So I'm going to give you an example of an audit that I did a number of years ago. So we were making sure that venous thromboembolism prophylaxis was being delivered to patients who'd had hysterectomy. So a previous audit had been done and had shown that actually a lot of patients weren't getting their VTE prophylaxis either in the form of mechanical prophylaxis or in the form of pharmaceutical prophylaxis in the form of low molecular weight heparin. So the standard that I identified was the NICE guideline, which said that for patients who've had a hysterectomy, they should have TED stockings on, so mechanical prophylaxis, and then some low molecular weight heparin for either 5 to 7 days if it was a benign patient, or 28 days if it was a cancer patient. So then off I went and I collected data on patients who'd been operated on between 2 dates, and I made sure that I'd include all types of hysterectomy, and then looked at the data from discharge summaries, theatre notes, and inpatient prescriptions as well. And what I'd found was, in the previous audit, there was between 4 to 93% compliance with the patients actually not getting their low molecular weight outpatient prescriptions to go home with. And since that last audit, there had been some educational sessions, there had been some posters, and actually that compliance gone up dramatically to 100%. So actually what had been done was really effective and was really working. So my recommendation was just to continue what we were doing and to re-audit again in 6 months, because we want to make sure that even though compliance was good now, we didn't want to let that slip. So I'm going to move on to quality improvement. So this is different, as I've said before. So first of all, you want to make an assessment of areas that might need improvement, and then you want to plan. So planning, I would say, is the most important part, because in a way this is the part where you can almost do an audit if you wanted to identify any problems before you then develop and implement a change. So within the planning, you can decide who's going to implement your change, where it's going to happen, what's going to happen. And on top of that, you can also decide on what data you're going to gather once you've implemented your change and you want to make sure it's working. So, but when we talked about having measurable goals, this is the stage at which you decide, how can I measure the effect of any changes that I make. So planning is, I would say, the most important stage. After that, you want to do, so you want to implement a change, and then after that you want to study how much of an effect that change has had. And then after that, you can decide on, actually, has that change been really good and you want to adopt that change, or you think actually that change made no effect to what I wanted it to make, so I want to abandon it. So that's ACT. So this is called a PDSA cycle, or plan, do, study, act cycle, and that's the kind of the basics of quality improvement. So I'm going to give you another example of something that I did a few years ago, and this was a quality improvement project on the management of patients with overactive bladder. And what I had noticed was that in overactive bladder clinic, there were a lot of patients who came for follow-up appointments, but actually nothing happened in those follow-up appointments, and a lot of the time patients just went home with some advice or nothing changed, but they were given another follow-up appointment. So I decided to do this quality improvement project, and what I did is I collected the data on patients in overactive bladder clinic over 3 years, and then looked at how many follow-up appointments these patients had and what action was taken at those appointments. And what I found was actually over a third of patients had nothing done at their follow-up appointment, and there was no change in the management. And a third of patients had a small adjustment to their medication, and actually only 3% of appointments had surgery discussed, which is really one of the few instances where you probably do need a specialist urogynecologist in clinic. So my recommendation was that we didn't need this many follow-up appointments, as many of them didn't need a specialist medical review, and what we implemented was a written guideline to help patients and GPs make decisions in the community about their overactive bladder management. So, for example, small increases in medication dosages, or general advice on reducing caffeine intake and reducing fluid intake before bedtime to reduce nocturia. So that was kind of the do part, and so this is really only half of a PDSA cycle, because actually what I should have done after that was seen if those proportions changed, if I collected the data again and then make a decision on whether we adopt that guideline or abandon it, and if it's not made a difference. But unfortunately, with medical training, you rotate, so I wasn't able to do that. But I think it gives you an idea of what can be done with quality improvement. So there are lots of benefits to audit and quality improvement. So first and foremost, improve patient outcomes. So you can see in the audit of my first example, you could see that patients were getting their VTE prophylaxis, and that means that they are less likely to get a venous thromboembolism, which is potentially life-threatening. And then with my second example, we hopefully increased the efficiency and cost effectiveness of the overactive bladder clinic because we were reducing the amount of times that patients were coming to clinic, which would actually then free up those clinic appointments for new patients or patients who did need to be there and need specialist urogynecological advice. And then lastly, I think it also does enhance teamwork. A lot of the time, you're not doing these projects by yourself. You get to know your team, you can communicate with your team, you can discuss the challenges and potential improvements, gather ideas, and it works between healthcare professionals as well. Often, you can involve your nursing team or your primary care teams as well, especially if you're working in secondary care. There are some challenges with audit and QI, so sometimes there can be resistance to change. A lot of times, if a particular service or a particular clinician has been doing something for many years in one way, they may not like to change the way that things are done, and that can sometimes be a bit tricky. However, if you come to them with evidence that you have gathered and collected and analysed, it does make those changes a little bit easier to swallow. Resource constraints can be very difficult actually as well, particularly with staffing and with different demands on people's time. Sometimes you can struggle to get the work done, or you can struggle to implement any changes because of resourcing. And then there is a little bit about balancing efficiency with patient-centred care. For example, with the overactive bladder clinic, we don't want to be seeing patients who don't need to be in clinic. However, sometimes patients do want to be seen in clinic because it does give them reassurance and it helps them plan what their next steps might be and how they're going to manage in the future. So you do have to be a little bit careful with your perspective when you're dealing with efficiencies and cost effectiveness. So I wanted to give you a few practical tips as you're going to be doing some projects with us during your time on your student selected module. So first of all, before you start an audit or quality improvement project, ask around, because lots of things have been done before, lots of things are currently being done, some things may have been started and not finished. So your colleagues will be able to help you develop your own ideas, but you may also be able to benefit from work that has already been done or ideas that have already been half developed, and you might even be able to make your project bigger. Make sure you register your audit or quality improvement project with the clinical audit team, and I've put the email address there. And the reason that you have to do this is, especially if you're looking at patient records, there are GDPR rules around accessing records, and so you do need a reason, and therefore any audits and quality improvement projects have to go through the review group and be approved before you start them. Going back to my other point, my first point about asking around also comes into view when you want some help with collecting data or analysing data or thinking about the best intervention. You're not always going to be around to be able to collect all of your data. You're going to have lots of different things that you need to be doing. So make the most of your colleagues and your friends, and often if you collaborate, you can get a much better project out of it. Planning is where the foundations of your success are made. So make sure you don't rush the planning. I would plan before you start any project. And you can even try piloting your project a little bit, so making sure that you've got the right logins for computer systems, or that make sure you have a look at your Excel spreadsheet and know what data you do want to be collecting before you start, and does that give you the information that you want at the end to make your intervention worthwhile. At the same time, I would say don't try and collect too much data or make your analysis too complex. Keep it simple, you'll get much more out of it, and you're probably more likely to finish it if you've done it that way. Talking about finishing projects, it's always best practice to present at your local audit meeting. You can also present quality improvement projects at those meetings, and it's quite a good forum, especially if you're not quite sure what the next step is to implement a change or take forward an intervention. Then that's quite a good way of kind of getting people on board, giving you new ideas, or gathering support. And as well as that, you do get a certificate which you can upload to your portfolio, which will become very important to you when you're applying for different specialties. And most importantly, again, best practice is always to do a re-audit after you've done an audit. So after you've implemented something, or you haven't, but you want to make sure that you're maintaining your compliance, then you should always do a re-audit. And with quality improvement, you could do an audit if there is a standard, but you should do some sort of evaluation of, you know, the change that you have implemented, and that could be an audit if there is a standard, or it could be a service evaluation to make sure that your intervention is working and is working in the way that you want it to be working. So I've put together a few resources to help you get started. So HQIP is Healthcare Quality and Improvement Partnership, and they're normally in charge of kind of national audits and projects that happen, and so they've put together some good resources to get you started. And there's also the Clinical Audit Support website as well. But on top of that, the trust that you're working at will have a clinical audit team or a quality improvement team, and they often will have the know-how of how to get things done within your organisation. So they're often a really good place to start as well. So in conclusion, so audit and quality improvement go hand in hand, but it's important to be able to distinguish between them. Both tools are used to improve safety and quality of care, and they're things that will ultimately be really beneficial towards your own learning and development. And I hope that you found this talk useful.